Okay, well, when I first came here, I was so concerned and afraid of the CPAP machine that it was collecting dust in my closet, literally. I wasn't using it. And when I went back to my doctor who treated me before and said, you need a CPAP machine, he said, I'm going to send you to this dentist, and it's going to sound weird, but give it a try, and I did. And one of the key things was I don't have much space in my throat. I remember as a child I couldn't swallow pills that well. And then I started using the device, advancing my lower jaw, which took a little while with me. I don't know if there are people that have gone faster, but then we tried the CPAP.
What was it originally about the CPAP that bothered you, or why was it not suitable for you?
It seemed to overwhelm me.
Mm-hmm.
The pressure seemed too high, but the people who, shall we say, I think their job basically is to dispense it. The respiratory therapist, they said, oh, it's got to be a pressure of 10 to be effective. I was questioning that. It always seemed to overwhelm me.
Yes.
And with my allergies, I tried the nasal hookup, and that just, I couldn't dare to fall asleep. I tried wearing it while I was awake, and it overwhelmed me. And with the nasal thing, I had to concentrate just on breathing while I was awake. And I was afraid that if I fell asleep, it would overwhelm me and I'd have air going in. I wouldn't be able to exhale.
So you found that the dental appliance, you could sleep a little bit better with it and made you feel better, but it didn't quite get you as well treated as you think you needed. Is that correct?
Did the studies, and I'm sure you'll show them the numbers, which are a bunch of them, but I felt better, but I wasn't enough. And then I tried the CPAP, and I was able, to my surprise, I was able to do it.
Do you think it was because of the lower pressures primarily?
The lower pressure, oh yes, that had a big factor.
Yeah.
And, before I had no confidence in it, that I'd be able to survive the night just about.
Yes.
And with this, I was like, I'm going to give it a shot. Then some things that I was afraid of, the people here explained some things to me, and I figured out a few things on my own. I was worried about the water from the humidifier getting too much, and then once or twice it actually sprayed me a little bit. One time when enough water got built up, and that leaked right away. The other time it made that noise, remember I told you, like when you take a couple of cardboard tubes and hit them against each other, that kind of hollow, strange noise started making that noise, and makes that enough.
That's great. Well, so over the last couple of months, you've now been wearing it several months, and you feel like this is a therapy you could use for long-term management?
Yes, definitely. I've been using it pretty much every night, and with no problem, especially compared to before. Before I was afraid to fall asleep with hooked up to a CPAP machine.
Well, Thomas, thank you so much. This is so helpful, and we appreciate what a great patient you've been.
Oh, well, thank you.